Thank you very much. I can't believe we're exactly on time. So it's my great pleasure to introduce our first keynote speaker, Karen Messing. She is a professor emerita of ergonomics at Université de Québec à Montréal. With the late Catherine Lapel, she co-founded a Union University research partnership on women's occupational health, focusing primarily including primarily researchers in ergonomics and law. She's the author of many scientific articles and of the following books. Most recently published in 2021, she wrote Bent Out of Shape, Shame, Solidarity, and Women's Bodies at Work. Another book published in 2014 called Pain and Prejudice, What Science Can Learn About Work from People Who Do It. And she's a member of the SAGE research team on health, gender, and equality. So Karen's presentation today is called Law, Ergonomics, and Community Organizations Toward a Partnership to Improve Working Conditions. She'll describe how low-wage employees, even union members, suffer from unsafe working conditions without being able to improve them. A classic example is the prolonged static standing posture of supermarket cashiers in North America who are deprived of access to stools despite regulations and case law, which should grant these. And she'll describe the history of scientific errors, injustices, and small progress that is made.
So thank you for inviting me to speak to this very, very interesting audience. I don't know that I've ever had such an interesting audience. I want to give credit and I hope you don't want to renounce it, Jean-Paul, but Jean-Paul and I wrote an article together, and a lot of the stuff in this presentation is going to be cribbed from the article. And Jean-Paul, how do I make this go forward?
To the right.
To the right, but there's, this thing goes to the right. There we go. It's a different picture of Catherine. Because her spirit, as everybody is saying, is here today, and we collaborated for a long time. And if I hesitate while I'm speaking, it's because her ghost is telling me, no, that's not exactly right. You got the wording wrong. And so this is, I'm going to try and do her honor. And I had also some data from collaborators at various other institutions. So I'm glad that you were talking about the university community partnerships, because my second slide has the aim of making you jealous or making you inspired to create these partnerships in a more permanent basis, the way we are able to do at the Université de Québec à Montréal, because we have a dedicated service to university community partnerships and really cushy conditions for professors who engage in them, because we get release time to do education and research in collaboration with communities, and we're given help, administrative help, free from this university service, so they take notes at the meetings and remind us that we said we were going to do things, and tell us when we did some terrible error and made the community mad at us. And this is really very helpful. And we've been working with them since 1993 in my case, with women's workers' health and safety, and the studies Invisible qui fait mal, GEST, and SAGE, which are different angles on women's occupational health and safety. And as Ellen said, they're mostly ergonomists and legal specialists, and the first one was done in collaboration with Catherine a long time ago, unfortunately. So today this is what I'm going to be saying. This is the outline of what I'm going to be saying this morning, which is that cashiers, and this goes for anybody actually who stands all day at work in a low-paid retail position, Static standing is bad for women's health. I'm going to show you why. Ergonomists recommend sit-stand stools. I'm going to show you a picture. Despite regulations and many tribunal rulings, cashiers stand all day in Quebec. And everything I say today about Quebec is also true of California and other jurisdictions. Little action by the health and safety authorities. I have a collaboration with Jean-Paul Dautel about this, and we did a little research on it. So the question is, why does the situation persist? And all the things that have gone wrong from a scientific point of view, a gender point of view, a social class point of view, and of course, the basic question of access to power. And so, as to make you recover in time for the break, I'm going to have to give you some good news at the end. It's not great news, but it's better than it could be. So, cashiers. Cashier is in the 2016 census the third most common job for women in Canada, and 84% of cashiers are women. And I don't know if you can see close up in these pictures, but there's cashiers sitting in Brazil, in Turkey. I found online this picture of Saudi Arabia, and I couldn't believe it. Even in Saudi Arabia, they're allowed to sit down. And they can only just recently drive since 2018, but before 2018, they were sitting as cashiers. And in Europe, generally, cashiers sit as well. But if you go to your local grocery store, you will notice that they're standing. So here's some data from 1998. I'll be telling you why it's so old. Pain interfering with my daily activities over the last year. And what we want to look at is we want to compare standing and sitting. And we can see there's a huge difference between the foot pain and the leg pain when you're standing and when you're sitting. And this is severe pain. It interferes with you. It's not just a backache or a leg ache. But if you compare women and men, you can see there's also a gender difference. And the question is this because women complain all the time and we knew this, or is there some other reason for it? And there's another reason for it, which is that if you look at what the word standing means, it means a whole bunch of different things. A professional standing activity, for example, you could include the Montreal Canadiens, and I think you have a hockey team here somewhere too. It can be reaching, it can be bending over, it can be a lot of different. The elementary school teachers spend the whole day like this. It represents different things. So if you have a questionnaire, and I'm saying this to everybody who does surveys, and you want to know about standing, you've got to distinguish between standing, immobile, static standing, and walking. They're very physiologically very different states. And guess what? There's a gender difference, and the gender difference is that women, when they stand, are much more often in a fixed position or a position where movement is restricted, as opposed to men who can move more. It's not an absolute difference, but it is a significant difference. And I think, the question is, why is these data so old? And the answer is that we no longer have the eco-test survey, which was supposed to happen every 5 years, the one that the data are taken from. We were able to get detailed questions on standing into the questionnaire. And the employers didn't like what they heard about musculoskeletal problems, among other things. And so the questionnaire has been blocked for since 2008. So I can't tell you how many people are doing static standing right now, unfortunately, but there's lots. So why do I think static standing is bad for you? It's because there are a lot of musculoskeletal disorders, and women have a lot more compared to men, but that's just a population statistic. But we have some experimental and survey data showing that constrained immobile standing is associated with leg pain and back pain. Also, there are epidemiological and laboratory studies showing that blood pools in the lower limbs if you stand for even 20 minutes. Orthostatic hypotension among standing workers, that's when you get dizzy because the blood is draining out of your brain. Poor pregnancy outcomes, shown by Agathe Coteau and her colleagues. Preeclampsia, which is pregnancy-associated hypertension. And in a nice study done by Peter Smith and the people at IWH, they showed that probably the incidence of coronary heart disease is associated also with static standing. So it's not good. And Nicole Vézina, who's been working on this since 1989, did a survey about 20 years ago of cashiers showing that static standing was associated with pain in the lower limbs among 38% of the cashiers. And these are young people mostly. And the lower back pain was associated also among 49% of these cashiers. So it's not an easy job. It looks like an easy job, but they move a lot of heavy objects in awkward positions, and static standing really gets to them. But Nicole developed with colleagues a sit-stand stool, which enables the cashier to be in a relatively standing position, but still have some of the pressure taken off the legs and back. She worked this out with the what was at that time, well, what is now known as the CNEST, which is our equivalent of WSIB. It's the it's the commission which has the paradoxical responsibilities of both prevention and compensation, which means that their prevention isn't the greatest if it means that they have to admit to something. There is an article in the Regulations of Occupational Health and Safety that says that workers shall have chairs or benches put at their disposal when the nature of their work so permits. There's laws, the regulations like this all over Canada. Jean-Paul found several, but there's also general duty provisions that would allow for seating. So they ought to sit, right? But in 1991, a tribunal ruled that seats should be installed at grocery stores, or at least at a grocery store. And this is a photograph taken 33 years later at the cashier's workstation, and it could come from any cashier's workstation in any Provigo in Quebec. And she's still standing. And more recently, there have been other cases. Whoops, yeah. Why is this photograph not there? Okay. And 5 years ago, there was a decision about the bookstores, and I went to the bookstore, and I looked, and that's what it looked like. There's no seats. And I asked the cashier why there were no seats, because they're unionized. And she said, my manager doesn't want me to. And she said, I asked, but he said no. So why is this still going on? First thing is that the science isn't the greatest. That is, there's most of the studies of standing and its effects show ambiguous results, or sometimes they even show standing is better, but it's because they conflate standing and walking, and then they do sometimes an adjustment for gender, so that does away with the difference in postures between men and women. And so people don't think that this is a dangerous posture. And the ergonomists who study standing and sitting and walking do a much better job, but it's for very, very short intervals so that when people come to say how long, for example, right now they're working on pregnancy guidelines in Quebec, and the guidelines about how long you can stand are completely arbitrary. They come from no research that I can possibly find because the data just aren't there. So, yeah. So the second reason comes, and I've got an anecdote about this. I'm in Sweden, I'm having lunch with the editor of an ergonomics journal, and I'm trying to persuade him that static standing is terrible and something should be done about it. And I point to Mustafa, who I happen to know, and he's behind the counter serving in the cafeteria. And I say, look at him, he's standing all day and his feet hurt. And the guy says, first he says, well, he should get better shoes. Well, I happen to know that Mustafa, number one, he doesn't make a lot of money, so the shoes are not going to be very fancy, but also Mustafa has to get new shoes every 4 months because he's spending so much time on his feet. So he really can't take the full responsibility for making himself comfortable in static standing. So we talk a little bit longer, and then I said to him, you know, when you're in a museum, don't your feet get kind of swollen because you're walking so slowly? Museum walking, you know, we were going to do a study with dogs, and we were going to attach sensors to the dogs. So there's a social class thing here going on, right? Because he's really sensitive to the museum walking. Another reason is that there's a lot of talk going on about sitting is the new smoking. Sitting is bad for you. And so the ergonomist, the thing on the right, I took it out of an ergonomics journal. I couldn't believe this. Look at how the woman, she can't possibly walk. She's got those little tiny shoes on her feet that they're impossible to walk in. And she's got this skirt that you couldn't possibly take a step in. And so they really want you to be standing. And I think the reason for that is that this is not the same social class that we're talking about. We're talking about a social class for whom standing is taken exercise. And exercise is good for you, I admit it. Yeah, they have more choice in how to, and in fact, there's a whole industry in ergonomics devoted to how you can have an adjustable standing and working position, and how you can make it possible for the workers to be autonomous in choosing their working postures. So the fourth one is, guess what? Employers are opposed to workers sitting, or at least to low-paid workers sitting. Okay, because they think that customers won't like being served by somebody who's sitting. They seem to do okay in Saudi Arabia, but for some reason they wouldn't do it here. They think sitting cashiers look lazy, and that's something that even cashiers told us when we interviewed them, that they were afraid of looking lazy if they sat at work. They don't want to redesign the cashier's work areas. So we heard that in 1991, but you know, they've really done a lot of different things with cashiers' workstations since 1991, and they probably could have incorporated a little bit bigger workstation for the cashiers. And they're moving towards self-checking. Now, that was something that I really took seriously a while ago, and I thought, should we just not bother anymore because there are not going to be any more cashiers? But for one thing, there are going to be other, like barmaids and Starbucks personnel who also should be sitting. So we kept on, and now what we have been hearing is that because of inventory slippage, some of the big chains are going back to cashiers and doing away with the self-checkouts. So this is something to watch. number 5 is a little bit complicated, but it gets down to the fact that when you're a low-paid retail worker, you have other things to worry about. And the main thing you have to worry about, and we did a study of this a few years ago, and I checked with the UCFW this last week, and it's I can still say exactly what I said on this slide 10 years ago, which is that scheduling is a nightmare for cashiers and retail workers in general. But we studied it in supermarkets. They get their schedules, despite Quebec law, they get their schedules 2 and 3 days before they start, which would be okay if they didn't change radically every single time. Your number of hours changes, as well as when your hours are, and they just are totally unpredictable. And it's a constant struggle for these low-paid workers to get enough money, enough hours to make enough money to live on. So that's the big, if we try to talk about struggling for seats, they're interested, but they think it's a kind of a pipe dream, and we should really be working on the schedules. So, on the other hand, the employer refused to distribute our results to the workers. They said if we wanted, we could name workers that we thought would be interested, and they would give the reports to those named workers that might be interested in making a fuss about the working hours. So the workers never got our report. Let's see. Yeah, and since there's a power dynamic going on about schedules, the workers are really reluctant to do anything that makes managers mad at them. And the way that they punish you is through the schedules, so that if there was any fuss about scheduling, then they would be afraid of reprisals. And finally, opposition from the Commission on Occupational, the Quebec Commission on Occupational Health and Safety. Nicole Vézina is the heroine of the cashier's struggle to get seats. She worked really patiently. She's a lot more patient than me. She was an expert in the 1989 hearing that led to the 1991 decision to get cashier's seats. She worked for 10 years, she sat on a committee with the representatives of all the supermarket chains, trying to get them to agree to have some kind of testing done of the seats. They said that none of the models were working, and so she said, okay, let's test them. She couldn't find a place to test them. Then they finally made a little pamphlet saying how cashiers' workstations could be rearranged and what were the arguments and what were the reasons for doing it. That was never used. They were supposed to write an article in the publication that the commission puts out every month. The article got quashed, but the guide actually exists since 2004 for implanting cashier stations in supermarkets, but it has not been publicized or used. And finally, the test that they did was abandoned after 4 months. So that's all the bad news. I promised you some good news. Oh, no, we still have one more. What was that? Oh, yeah. Oh, yes, enforcement. A little parenthesis that Jean-Paul and I came up with, which was we did an access for information request that asked for any inspection reports during 2023 that cited Article 170, which I showed you but didn't read to you, but is the one that says the workers should have seats when the conditions permit. And so we got 11 relevant inspection reports back. The one that we liked the best was the one which was in a dépanneur, in a I don't know what they're called in English, but thank you. And the inspector said, well, it was okay because they could sit on milk crates during their break. Another one was in a large retail store where they worked it out that the workers who received clients could get a backless stool that rotated, but not exactly what we would have prescribed. One inspector, just so that I'm not it's not all negative, was actually installed appropriate seating for a daycare center where the employer had originally said it wasn't necessary because they could sit on those little seats that the kids have that are, but the inspector said no. And one inspector, and this is, I guess, some of the good news, that has been working for a year with a supermarket trying to get seats installed. And this, and just to show you how little inspection there is, there's over 1,000 companies per inspector, so one can understand why they don't insist a lot on things. So finally, the good news is that there's now a coalition of women's groups and unions working together to try and get this changed. We've met maybe 4 times so far. We're doing a questionnaire to ask consumers whether they really, really, really insist on having workers stand. We're hoping they say no, but you never know. And it is because of them that this one supermarket has been working on getting seats for the cashiers. So we're hoping that that's going to show that it can be done. And so our question is it going to work this time? And thank you. And the marketing message is above.